Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion Chuck Carroll at the International Conference on Nutrition and Medicine 2022 here in Washington, D.C. You know, within a small radius, there are a number of hospitals around where we are sitting today. And not just at those hospitals, but literally at hospitals across the country and around the world, there is an epidemic. It's not just the epidemic of illnesses that the patients are there being treated for. It's what the patients are being served. The menus can be quite unhealthy, some dare say atrocious. But my guest today is here to tell us how to implement healthier fare in hospitals so that when the patient goes there, they're getting what they need, not just from medicine, but from nutrition as well. With that, we welcome Dr. Monica Aggarwal. So good to see you again in person, no less.
I know. It's always fun to see you, and then I agree. In person, I always like it because I get to see what people wear for their shoes and how different people are. I love that. You know, it's so fun to see people in person, and I haven't done it in person in a while, so it's nice to be here.
It's so good to have you here. I could talk shoes with you. I love your silver shoes, by the way, but that's not what we're going to talk about today. Today, we're talking about hospital food, and it always strikes me that even in a cardiac wing, where somebody has come in, they've survived a heart attack, maybe they're in there for a cardiac procedure, and what are they being served for breakfast? But, you know, bacon and sausage and all of the things that we know are the very foods that likely contributed to them being there in the first place.
Yeah, you know, the biggest problem is, to be fair to the hospital systems, is there's just a significant lack of knowledge. And the people that are actually making the menu are not the same people who are maybe managing the illnesses. And so there's just this huge disconnect. And so, you know, JCAHO, which is, you know, our hospital commission, says, well, you need to make these healthy meals that are condition specific. And so, well, that could be anything. And so when we've looked at this and we've evaluated different hospitals, we found that there's a huge array of what that actually means. So, for instance, the sodium content in a low sodium diet can be variable up to 1,000 milligrams, and carb consistent diet and low fat and cardiac. And so, as you point out, cardiac diets are kind of yuck, you know. So patients come in, they get a stent, they get medications put on, and then they're eating roast beef or a hamburger or French fries, and it's not that they don't fit the cardiac menu. So what they've done is that they look at a cardiac menu as based on percentage of fat, percentage of cholesterol, and they use these numbers. And if they fit into, they do the nutritional profile of these foods, and they say, oh, okay, it's about right, and that's what then gets shipped. But it doesn't, and there's just this disconnect where people who are making those meals just pop it in those numbers into those little algorithms, and then they put them out. But nobody's actually saying, wait, actually, animal products or roast beef or these kind of foods have loads of saturated fat, and
Right.
Saturated fat is bad for the heart. Why are we doing that? Or why are we giving people fruit juices who have diabetes or who have heart disease, because that's just going to make your sugar go up? I mean, there's just so many disconnects there. So that's something that as we were challenging ourselves to learn how to change that, we did a lot of research on what was out there. And it was really interesting to see how little is known by hospital systems about, number one, what they're serving, who's making the decisions. The physicians have no idea. They're not involved at all, actually. And the residents, who are often in the trainees, are the ones that are ordering these menus. And all they know is to check cardiac diet, check diabetic diet. And they have no idea what's in there. They have no idea. They're never there when the meals are served.
So I hear you, and that's a problem that needs to be rectified. But then I think back to even before I tried to clean up my own health and really became ingrained in nutrition, at no point in my life did I think that a hamburger and French fries was a healthy meal. And so I guess that's kind of the problem that I wrestle with just from a lay perspective, is even though it does technically fit the criteria, at what point does common sense kick in?
Yeah, a good question. And I think as I worked with the University of Florida to make this plant-based menu, there was a lot of that. We're like, you know, and so I think that the most important thing in this situation is to not look and say, what the heck have you been doing all this time? Is more to say, okay, well, this is the way it's been going, but let's just sort of think about this. And it's a lot of education and sort of humility in these situations. And I don't think that people are dumb. It's just that there's just nobody's thinking about it. And so once you sort of put some attention and focus on it, then people start thinking, okay, you're right. And one of the administrators at UF who's involved in dietary, she said to me, well, I don't eat this way, but this is what patients want. And so then if you just pause there for a moment with that person and say, wait a second, you don't eat that way because you know it's not healthy, but yet this is what people want. Like, then people start saying, oh, yeah, I guess that doesn't make sense, right? And so it's a whole lot of lack of education, unfortunately.
Yeah, well, a kid's going to want to touch a hot stove just to see what's up. The parent knows that's not good for it. The parent doesn't let the kid touch the hot stove. Again, at some point, common sense. I mean, so to me, that seems like one of your biggest barriers is just kind of breaking those walls down. A huge task, easier said than done. What are some of the successes that you've already experienced, though?
Yeah, I mean, we am proud that we have a 100% plant-based menu at the University of Florida, and that was about a year's worth of task. And one of the things that people were really worried about, and the biggest thing, is that customer service ratings, right? And they say, well, I sort of joked, and when I gave the talk, I said, people would say to me, like, Dr. Agar, well, you're from the North, right? And I would say, yeah, I sorta. I mean, I'm from Maryland, but yes, I trained in Boston. But this here's the South, and like our patients like to eat meat and potatoes. But so my comment to that is not to say, well, that's dumb. It's just to say, well, okay, I understand that meat and potatoes is what they've eaten for 50 years, but they just had a heart attack, and their heart is dying because of the choices that they've made. So we want to implement changes that it doesn't almost matter if they don't like it, as much as this is what they should be eating. And what happens, and I don't mean to sound callous about it, obviously we want people to enjoy their food, but we want people to learn to like their food. And, I have a son, I have 3 kids. Everybody knows I have 3 kids. But when my son was 9, he used to say to me, Mama, I don't like kale. And I said, honey, I love you, but I don't care. And, and so like, that's true. Like, I don't really, I mean, I care, but I don't care. And so, I'm being funny about it. But at the end of the day, we want people to eat these foods. And so a lot of it is sort of trial. And just like when I was 19, I didn't like Thai food because I'd never had it before. I thought it was weird. And then after 5 tries, I was like, oh my God, I love this stuff. And Thai food is actually my favorite food. And so, it's everything's about changing palates, getting people comfortable, making sure people understand that this is the way you have to eat. For instance, in my clinic, I have a hunter in my clinic, and he was hunting for, that was his livelihood. And he had 9 stents in his heart. And he came to me because he was looking for like somebody to fix his cholesterol, make him better so he wouldn't have to go to the hospital. So imagine 7 or 9 stents or whatever he had almost every year until we met. And so I talked to him and I said, look, here's the thing. I know you're a hunter. I know you make your money off of hunting, but that food that you're eating is hurting your heart. And so I asked him for 3 months, and I said, let me work with you for 3 months, and if I'm wrong, I will give you a gift certificate to your favorite restaurant. Ooh, and let's see how this goes. I do that challenge a lot, actually.
Nice.
And so we worked together for 3 months, and he couldn't believe the change. And so now I can say, a couple years later, that patient has not been back to the cath lab in almost 5 years. He has no stents. He is on a statin, but he is like a minimal dose of statin. His cholesterol is ridiculous. He looks amazing, and he's no longer a hunter anymore. But he stayed a hunter for years and just didn't eat it, and then eventually said, you know what, I don't actually want to give this to anyone else. But again, how did that deer hunter change? Well, he changed not because I'm so smart. It's just that it was about sort of gentle education, humility, kind of teaching people. And it's not that he doesn't know. He probably knows that a hamburger and fries isn't good for him, but he hasn't connected it, right? And so it's just sometimes you have to help people with that connection. And that's what we did at the hospital. We tried to get people to make that connection.
Yeah. And there's also by the way, you should lead with that story always. I mean, that is one of the more powerful things that's been said on this show. I mean, it's not just, like I've been unhealthy my whole life. This is a person who has built a career off of slaughtering and eating meat. And you said like 7 stents, 9 stents, something like that. Like, that is an incredible amount. And then for that person then to see the transformation, buy into it, leave that trade, find a whole other career. That's something else right there, Doc. That
It's
is
amazing.
really something else.
It really is. It's amazing. And, I've known this gentleman for years, and he's a lovely man, and I continue to see him. It's really fabulous.
What's the maximum number of stents a person can have? That seems like an awful lot.
Yeah, so I don't know if that I could say that there is a number. Everybody's vessels are different sizes, and yeah, it's not. It's sometimes they're stent in stents and that kind of thing, and
Yeah.
so there is no number that I could say offhand. But yeah, that's a lot of stents. I mean, I think any stent more than 0 is unfortunately too much, but it's not a failure if you have stents in your heart. It just means that there's room to improve.
What kind of feedback have you received from the other doctors and hospital administrators now at UF, where it's exclusively plant-based, as you said?
So it's not exclusively plant-based, just to clarify that we have a plant-based menu, but one of the things they were worried
Gotcha.
about is that we were going to try to make everybody vegetarian, and that would be awful. And so that was one of the things that
Would it be?
I know. So right, exactly, right. So that's so all the menus are available, but we definitely encourage the plant-based menu. So we got a lot of friction from administrators at the beginning, but mostly because, again, of lack of knowledge. Like a lot of people who talk about their experience with their hospital, they go to the C-suite and they've gone and they've met with the CEO. I didn't do that. That wasn't my experience. I just walked into the hospital and met with the head of nutrition and dietetics and said, this is who I am, and I have the benefit of, realize being a cardiologist, and I don't take that lightly, but I walked in and I said, this is what I do for a living. This is how I fix patients. I'd like to work on the menu. And, that's when they all kind of look at you like, yeah, and, like, that's weird. Like, we don't do that down here in the South. And
Yeah.
a lot of that. But it's amazing. I showed a video in my presentation where the person in the video was actually my biggest against everything I was saying. And now by the end of the year, she was my biggest advocate.
Outstanding.
Yeah. So it's
Outstanding.
really cool.
Has there been any sort of research that's been done about the outcomes of patients who have that plant-based intervention very early on in their treatment plan versus those who aren't close up in nutrition?
It's a great question. So, my residents were putting that together, and we don't have any data on that, but we have data from our outpatients, certainly, where we collected data on our prevention clinic, where we put people on this dietary change, and we have data to show that their lipids get significantly better, and we do better. I compared it to other cardiologists in my own group. And we published that data, and my fellow actually presented it at the American College of Cardiology, which is great.
That's fantastic. I'm so happy for everything that you're doing. I think that really your program there, what you've done, can serve as a model around the country, hopefully even on a global level as well.
That's
Have
nice.
you thought about that, scaling it up to that level?
Well, it's a work in progress. And so certainly, we got into the inpatient world and then we did the outpatient, but there's so much work to be done. We still have deep fryers. We still have vending machines. We still have loads of sodas. We still have, what's that? Panda Express. We still have loads of work to be done. And so I certainly don't have the formula for everyone. I think that I have a formula that worked for me. I've encouraged people to try it, reach out to me, and I can help with their hospitals. Like I worked with Yale, I worked with Kentucky, I worked with like 10 to 15 hospitals that have reached out to me, and I'm able to work with their staff, and I've been able to help them make changes, which has been really cool to see. And when they get on the call, they're initially like, well, I don't know about this, but then by the end of the conversation, they're like, oh, we could do this is doable. So that's sort of how I try to implement change, is by sort of showing what we do and then trying to make that impact. But I think there's so much work to be done in this space. But things are changing. Right? You can go anywhere now and get a plant-based meal. Things are changing. The world is changing, and people are starting to look. So I think that we have the benefit at conferences like this, and you and me and all of us, of getting the word out, getting people to know what we're doing, and then slowly there will be change.
And I also think the fact that nutrition is such a passion of yours for personal reasons, I
Yeah.
think that, to have somebody like you leading this movement is critically important, because you know the value in this, and there's nobody that can champion it better than somebody who's already been in the trenches themselves. So
Thank you. I don't know. I definitely am deeply invested in dietary change, and you're right. Every single thing I do on a daily basis, I think about my own health. And if I can do it, I mean, I've told people, somebody made a T-shirt for me. Dr. Agarwal would eat dirt if she knew it was good for her. Well, that's true. I mean, I would. If I knew it was good for me and there was data to support it, I'd eat it, because I do believe I'll do anything to stay healthy. And if I hope that people will feel the same way about their own health. And you have to be your biggest advocate, and you know that plant-based eating is the optimal way to eat. And whether you try to eat Mediterranean plant-based or plant-based, I don't even care. I just want you to eat more plants. Like, don't focus on these details and just eat more plants.
Well, I'm going to be keeping my eye on you, Dr. Agarwal, for sure.
Uh-oh.
Everything that you're up to.
Okay,
You're
well.
doing good work. You're doing
thanks.
good work. I
Thanks a lot.
appreciate you stopping by.
It was great to see you.
If your health IQ is a couple of points higher than it was a few minutes ago, go ahead and like this video or subscribe to the YouTube channel. And to take it even higher, head over to Apple Podcast or wherever you get your favorite shows. Look for The Exam Room by the Physicians Committee. Hit the subscribe button there as well and help to make your world a healthier place.